Quervain Disease. Anatomy would be extensor pollicis brevis, abductor pollicis longus, fibrous osseous tunnel, which is the radial styloid process, reticulum, and the base of the pathology would be inflammation of the tendons in the wrist and lower thumb due to tendon being swollen, rubbing against the narrow tunnel they pass through. It causes pain at the base of your thumb. Mechanism of injury would be performing repetitive wrist acceleration and deceleration, every use of the wrist and tendons, and their sheath. Rheumatoid arthritis and scar tissue, which restricts normal movement with. Signs and symptoms could be pain with use or pain with passive stretching, tendon swelling over the tendon, sticking or stop and go sensation in the thumb while moving it, trouble moving the thumb and wrist while grasping or pinching, like in the picture. Yes, first one is Finkelstein.
Pepsi is made for football. Watch it.
In this video, we are going to show you the original version of the Finkelstein test. On the test, have your patient's affected extremity extended so that the wrist remains at the edge of the treatment table. The arm is positioned with the ulnar aspect of the forearm on the table and the ulnar aspect of the hand hanging off of the edge. The forearm is maintained in neutral. In the first step, the patient's pain is assessed with gravity-assisted, gentle, active ulnar deviation at the wrist. This version is suitable for patients who present in the acute phase. This test is positive if the patient reports pain aggravation at the tip of the styloid process. If version 1 does not elicit pain, gently apply an ulnar deviation force to the hand, which results in increased passive stretch across the first dorsal compartment. Again, this test is positive if the patient reports aggravated pain over the styloid process. If the second step is still not provoking, we will perform the original version described by Finkelstein et al., which is suitable for patients in the chronic stage that are unlikely to experience substantial pain in the first two steps. In this third step, grasp the thumb and then passively flex it into the palm. A positive test result is recorded if the patient experiences increased pain over the tip of the styloid process. Performing the test in this stage. In this video, I'm going to show you the Eichhoff's test for decavase tendonitis of the thumb. In this test, have your patient extend his affected extremity and rest it on the treatment table so that the wrist is hanging off of the table. Then ask him to make a fist with the thumb inside his fist, stabilize the forearm on the table, and gently deviate the wrist towards the ulnar side. This test is positive if your patient experiences pain over the tendons of the extensor pollicis brevis and abductor pollicis longus, which both form the medial base of the anatomical sniff box. Due to its very provocative
Predisposing factors are age, which is more common in the ages of 30 through 50, and also more common. Picking up a baby could cause this, and it's depending on how they pick up the child. So like in the picture, that's where a lot of the disease cause by picking up a child, just how you're putting most of the comes for, and also occupation. Differential diagnosis is ganglion cyst, radial nerve entrapment of the forearm, wrist extensor. Management and treatment would be for acute pain inflammation, ice massage for 10 minutes for the first 48 to 72 hours, NSAIDs and rest. If swelling is subsided, perform some ROM, and then ultrasound or phone can be used for anti-inflammatory. Referral and Immobilization, they split for 4 to 6 weeks. Refer to a doctor if the disease is severe. Possibly the doctor may or strength. Prevention, prevent from doing the same wrist. Mulligan could be a radial or ulnar glide, which it depends on which one has no pain.